And let me now introduce Dr. Karthikeyen Natarajan, who is joining us from India. And let me again present his lecture or presentation, which is called Functional Independence in Autism Targeted Through DOAST Integrated Therapy. And we will have Dr. Natarajan to answer some respective questions after the presentation.
Good morning, brothers and sisters. Millions of families around the globe who have children with autism hope for a behavioral improvement and cognitive improvement so that the children will become functionally independent when they become adults. This is the target with which the DOAST Integrated Therapy Center in India has been functioning for the past 2 decades. We have been replicating results, positive results. I've come here to share that experience with you as to how we did it. Thank you so much for giving us the opportunity. We consider that the brain as a hardware which is inflamed and not able to take the software of learning. The chronic inflammation is the common denominator, causing connectivity and processing abnormalities in the functional areas of the brain. When the connectivity is a problem, learning is a problem, output is a problem. We differed from the hardwired concept which was prevailing that time, way back in 2003-2004. We believed that the autism could be rewired, and we believed in the capacity or the capability of the Indian medical systems to give us tools to achieve our target. We consider the neuroglial inflammation, which is an outcome of primarily the gastrointestinal inflammation producing cytokines, vasculitis and oxidative stress, resulting in symptomatology of autism. Cumulatively, we hypothesize that the upstream molecular systems were disturbed by inflammation in the downstream systems, predominantly the gastrointestinal system, producing cytokines, and cytokines on a chronic basis affecting the blood-brain barrier. The neuroglial inflammation affecting information transfer between the functional areas of the brain. When there is no information transfer, you could imagine many of the symptoms of the children with autism. So our target was restoring synaptic connectivity. We hypothesized a therapeutic concept of reducing the cellular stress, eliminating the toxin, by which achieving rejuvenation and regeneration. Basically, this is the concept of the traditional Indian system of medicine. I've been mentioning the word integrated therapy, the meaning of which is we have chosen the best of the medicines and then tools and techniques from the traditional medical science. And the chosen techniques are checked for safety and cost effectiveness through the tools of the modern medical understanding. Teach the parent about the technique. Most of the application of the treatment techniques in a center is parent included, so that they gain in confidence and their psychological problems or minimized day by day when they see the children improve. We catch the children very early. We try to catch them as early as 3 years and then start the early biological intervention technique. I have to mention here our early intervention is biological and it goes to correct the system from inside out. Or the diet practiced is sattvic diet of yoga along with herbal supplements, and we do yoga in the full form starting from the early age, and we supplement it with oleation therapies and then lifestyle changes. I invite you to have a look at the videos which follow, which will explain our technique and the outcomes.
வரைக்கும் நார்மலாக வளர்ந்தான். அதுக்கப்புறம் இவனுக்கு பேச்சு சரியாக வரல, ஹைப்பர் ஆக்டிவாகவும் இருந்தான். பல டாக்டர்கள்லாம் போய் கேட்டதில் கடைசியாக இவனுக்கு ஆட்டிசம்னு சொல்லி டயக்னைஸ் பண்ணாங்க.
What is your name?
Name. Name.
Mine
is Sunai.
Our second child, and when we found out he is autistic, we were really heartbroken. He has been attending DOAST for about 2 months, and within these 60 days he is coming up really well, and I can see that he can follow small instruction, and he is coming up with few words now, and he is really calm now. He is not as before. And
TCIM delay. TCIM delay. The yoga hall पर ये वाला colorful है. Volume लिया ना. The yoga hall. आश्रम में देखते. आश्रम में तो. आश्रम.
Mountain. Lie down, namaskar, lie down. Lie down. Raise the keep up, astanga namaskar. Hold your right leg. Hold your right ankle joint. Ankle, take it back. Take it back. Tarun, take it back. Hold your left leg. Take it back. Sitting Vajrasana. This is Vajrasana. Tie your hands back. Monish, close your mouth. Breathe in. Monish, Nilesh, close your mouth. Breathe in. Breathe out. Bend down. Forehead down. Right knee down. Place your right foot. Hands back, Monish. Hands back, Monish. Back. Come on, look up. Bend down. Come up. Come up. Come up, Nilesh. Come up. Bend down. Come up.
Sit your hands, bend forward, maintain,
relax, close your eyes,
Aisha.
close your eyes, close your eyes.
Left foot, left ankle, left shin, left knee, left thigh, left hip, stomach,
Put
your right leg left.
your right leg left.
Your right leg left.
Put your right leg back.
Your right leg back.
Put your right leg front.
Your right leg front. 11. Raise your hands up and join your path. நேரா பாத்தீங்கன்னா தான் உன்னால நிக்க முடியாது ஜோன். Maintain. Right leg up பண்ணு. Right leg up. நல்லா. Knee straight. Okay, very good. Maintain. 1, 2, 11, 12, 13, 14, 15. Then left leg. Knee straight பண்ணிக்கோ நல்லா. கால் நல்லா நீட்டி வை. காலை நீட்டி வை. Knee straight. 15.
In the absence of a biological marker, exhibition of improved cognition and behavior goes to prove that amelioration of inflammation is happening in the neuroglial systems and better information transfer between the functional areas of the brain and coherence are developing, which would ultimately end up in making that individual functionally semi-independent at least by the age of 18.
இசை கேட்டால் புவி அசைந்தாடும் அது இறைவன் அருளாகும். இசை கேட்டால் புவி அசைந்தாடும் அது இறைவன் அருளாகும். ஏழாம் கடலும் வானும் நிலவும் என்னுடன் விளையாடும். இசை என்னிடம் உருவாகும். இசை என்னிடம் உருவாகும். ஏழாம் கடலும் வானும் நிலவும் என்னுடன் விளையாடும். இசை என்னிடம் உருவாகும். இசை என்னிடம் உருவாகும். இசை கேட்டால் புவி
Tarun.
Thank you for your presentation, and if we can ask you to answer the question, and because we thank you to join us also online, and we've got a little time for a question. So, I will read the question now. Can a mother reduce the risk of autism during pregnancy?
Can you repeat the question, please?
Can a mother reduce the risk of possible autism during a pregnancy? Or what are the risk factors that mothers should avoid?
Oh, the risk factors. Yeah, I can tell you the first risk factor is the smartphone. Do not use your smartphone during pregnancy. And you keep your mind at peace. Stress is one thing which can cause a lot of damage. And we have had a lot of experiences with mothers sharing that they had a lot of stress during the time of pregnancy, and that resulted in autism. And we now tell the parents, the practices of Ayurveda and yoga, chanting of Om and chanting of Vedic literatures, all this have a positive influence on the health of the fetus. And this has been proven over the years. And there are a lot of, examples in the literature. And that could be used by the modern lady who is pregnant, who is exposed to a lot of stress. So this is our general advice. And then again, the food, the smoking, the alcohol, all these have influence on the developing fetus. We do not know exactly what is the reason for development of autism, but these things help. And especially if you have the first child autism, second child, you need to be very, very careful. And after birth or during birth, you aim at a normal, natural delivery. That is one thing which can assure that the child gets the favorable antibodies to withstand. So if there are studies to prove that cesarean section, the risk of autism is more. And again, after pregnancy, you feed the child. The breast milk is very important. And then breastfeeding a child at least for 18 months is insurance against these kind of problems.
Dr. Natarajan, thank you very much for joining us and answering the question.